What is the measles, mumps, and rubella vaccine? The MMR vaccine is a mixture of live but weakened measles, mumps, and rubella viruses. The vaccine helps the body build antibodies to these viruses and protects against these viruses in the future. These antibodies usually last for life. In the United States, the MMR vaccine is usually given during childhood in 2 doses. I'm not sure if I ever had the MMR vaccine. Should I get the vaccine before getting pregnant? This is a common question many women have when planning for a baby. Understanding the importance of vaccinations and their timing can help ensure a healthy pregnancy and baby. It is recommended that all people of childbearing age who do not have immunity to measles, mumps, and rubella receive the MMR vaccine at least 1 month before getting pregnant. This is because these diseases can cause serious complications during pregnancy, including miscarriage, premature birth, and birth defects. If you were born outside the United States or are not sure if you were vaccinated, your healthcare provider can do a blood test to see if you have antibodies to these viruses. This test is simple and can provide peace of mind, ensuring that you are protected before you conceive. I just got an MMR vaccine. Now you might be wondering, what's next? How long should I wait until I get pregnant? The Centers for Disease Control and Prevention suggests waiting to get pregnant, if possible, until 1 month after receiving the MMR vaccine and your immunity is confirmed by a blood test. This waiting period allows your body to develop the necessary antibodies to protect both you and your future baby. During this time, it's a good idea to consult with your healthcare provider about any other vaccinations or health concerns you might have. They can provide personalized advice and ensure that you are in the best possible health before starting your pregnancy journey. Remember, taking these steps not only protects you, but also helps in giving your baby a healthy start in life. Does getting the MMR vaccine increase the chance of miscarriage? Miscarriage is common and can occur in any pregnancy for many different reasons. It is not known if the MMR vaccine can increase the chance of miscarriage. Infection with measles, mumps, and/or rubella during pregnancy may increase the chance of miscarriage. Does getting the MMR vaccine increase the chance of birth defects? This is a common concern among expectant mothers and their families. Every pregnancy starts out with a 3 to 5% chance of having a birth defect. This is known as the background risk, which is the baseline risk present in all pregnancies, regardless of any external factors. This background risk is influenced by various factors, including genetics, environmental exposures, and maternal health conditions. There is no evidence to suggest that getting the MMR vaccine during pregnancy increases the chance of birth defects. Extensive research and numerous studies have been conducted to investigate this concern. Information from at least 1,600 pregnancies in which the MMR vaccine was given right before or during pregnancy found no increased chance of birth defects. These studies have been peer-reviewed and are considered reliable by the medical community. The MMR vaccine is not recommended during pregnancy because of a very small chance of illness from the weakened viruses in the vaccine itself. This recommendation is made out of an abundance of caution. This is very rare in the general population, and the likelihood of any adverse effects is extremely low. The weakened viruses in the vaccine are not strong enough to cause illness in most people. And there has never been a documented case of CRS from the MMR vaccine. CRS, or congenital rubella syndrome, is a condition that can cause serious birth defects, but it has not been linked to the MMR vaccine in any documented cases. It's important for pregnant women to discuss any concerns with their healthcare provider. They can provide personalized advice based on individual health needs and the latest medical guidelines. Overall, the MMR vaccine is a crucial tool in preventing serious diseases like measles, mumps, and rubella. While it is not recommended during pregnancy, it is safe and effective for most people and helps protect public health. If you are planning to become pregnant, it is advisable to get vaccinated before conception. This ensures that you are protected against these diseases without any risk to your future pregnancy. Always consult with your healthcare provider to make the best decisions for your health and the health of your baby. They can guide you through the process and address any concerns you may have. Remember, the goal is to ensure a healthy pregnancy and a healthy baby. Vaccines play a vital role in achieving this goal by preventing serious infections that could harm both mother and child. Does getting the MMR vaccine increase the chance of other pregnancy-related problems? Well, It is not known if the MMR vaccine can cause other pregnancy-related problems such as preterm delivery, which is birth before week 37, or low birth weight, which is weighing less than 5 pounds, 8 ounces at birth. Because the MMR vaccine is not recommended for use during pregnancy, vaccination in the second and third trimester has not been well studied. Will getting the MMR vaccine during pregnancy affect future behavior or learning for the child? This has not been well studied, but, based on the available data, getting the MMR vaccine during pregnancy is not expected to cause behavior or learning issues for the child. Breastfeeding and getting the MMR vaccine. The MMR vaccine can be given to people who are breastfeeding. Be sure to talk to your healthcare provider about all your breastfeeding questions. If a male gets the MMR vaccine, could it affect fertility, or the ability to get a partner pregnant, or increase the chance of birth defects? This is a common concern among many individuals considering vaccination. Studies have not been done to see if the MMR vaccine could affect male fertility or increase the chance of birth defects above the background risk. However, extensive research has shown that vaccines in general are safe and effective. The MMR vaccine, which protects against measles, mumps, and rubella, has been used for decades with a strong safety record. When a male gets vaccinated, this can help protect his partner, a pregnancy, and children from getting infected with these illnesses. Measles, mumps, and rubella can have serious consequences, especially for pregnant women and young children. By getting vaccinated, males contribute to herd immunity, reducing the spread of these diseases. In general, exposures that fathers or sperm donors have are unlikely to increase risk to a pregnancy. It's important to consider the broader benefits of vaccination, not just for individual health but for the health of the community. Vaccination helps prevent outbreaks and protects those who are most vulnerable, including pregnant women and newborns. Consulting with healthcare professionals can provide personalized advice and reassurance about the safety and benefits of the MMR vaccine.